Celebrite and the extension of that, the Serenabrite biopsies, have allowed us to peer into the breast in a much more detailed fashion to find breast cancers in those patients who have dense breasts that we may be missing on conventional mammography. There is a subset of the population that we are just not serving. So the Celebrite and the Serenabrite biopsies have allowed us to serve this subsegment of the population. The quicker you can do the biopsy, the more you can do it in a physiologic manner in which the patient is sitting down as opposed to lying down, where they may have eye contact with myself or with a technologist or an aide, then they're much more likely to be calm.
We want patients to be not only comfortable with their experience, but to understand that they're getting the best and most advanced care they can anywhere. This procedure is the most comfortable way to get the answer that we need. We need a diagnosis. We have an abnormality. How are we going to serve that patient in the best way possible, with the least harm possible? This procedure allows that because we're able to confidently access the lesion. Some of these lesions that we send to the for Serenabrite biopsy, you can't see another way other than MR.
An MRI-guided breast biopsy may take an hour. The Serenabrite biopsy sometimes takes 5 minutes, and maybe they're in the room for about 15 minutes. The reason we want to do the Serenabrite is because it's much faster, it's much more comfortable for the patient, and it's certainly less anxiety-prone for the patient.
The reason we do this is we have to give them an answer. We don't want to say, well, we'll see in 6 months. We want to know what it is today. The faster you get an answer, the better it is. And the thing that frequently is overlooked is these are people, you can tell someone not to be nervous, but they'll be nervous, and they'll be nervous for 6 months waiting for that answer. When you could give somebody an answer and put something to rest, it provides a lot of comfort. And at the end of the day, it's not just finding out what it is, but also helping the patient get through that process.
Psychologically, they want to know. There's a lot of doubt, especially if you tell them that something is very suspicious. In the end, we want an accurate exam where the patient's comfortable and where there's no anxiety induced. So really, the Serenabrite meets all of those criteria